up to 80% of the disproportionate impact of heart disease is because of non-clinical factors, what we call social determinants of health. So it's things like access to healthy foods, access to healthcare, and those types of things.
Welcome to Baptist Health Talk, a podcast on all things healthcare, powered by Baptist Health South Florida, your trusted source for healthcare prevention and wellness.
I'm your host, Nicky Gelin, and welcome back to a new episode of Baptist Health Talk, where we answer your most searched questions on trending topics. Today, we'll explore a critical aspect of health that affects us all, but plays out differently depending on who you are and where we're from. We are joined today by Dr. Marcus St. John. Thank you so much. He is the Interventional Cardiologist at Baptist Health Miami Cardiac and Vascular Institute. Thank you for being here.
Thank you, Nikki. My pleasure.
Thank you so much. And this topic is so near and dear to my heart, so let's dive right into it. What does heart health look like in minority populations? What challenges do they face when it comes to staying on top of their heart health?
Thank you, Nikki. Heart health is very similar in minority populations as it is in general populations, except that we are more disproportionately affected by heart disease. When we talk about heart disease, we're talking about things like heart attack, stroke, heart failure. And there are many things that contribute to heart disease, which we'll get into. Some of the statistics around heart disease in minority communities is that African Americans are 3 times more likely to die from heart disease than non-Hispanic whites. So while we have seen many improvements over the years in heart disease treatments and management of risk factors, those benefits have been less well shared and less well propagated among minority and under-resourced communities.
Really? Okay, so my background is Caribbean, and growing up, and even in my adult life, we've always been told, oh, it runs in the family. And so I would think that technology and research would have advanced since back then to where we are right now. So why do you think there's such a lack in research, especially with minority communities?
Yeah, the technology and research have advanced, but the fundamentals still remain the same. So it comes down to what we call risk factors, things that increase your likelihood of developing the disease, things like high blood pressure, high blood sugar, smoking, sedentary lifestyle. And unfortunately, access to some of the technologies and advances that you mentioned are less readily available in some communities because of financial constraints, where you live, and those types of things that we'll delve into. So the benefits of the research and the benefits of technology are not equitably distributed.
So still a work in progress.
A work in progress,
Right.
That's for sure.
What are some of the most common aspects of heart disease that you see in minority populations? And how do they differ from the general population?
Yeah, so as I've touched on, the most common types of risk factors for heart disease include things like high blood pressure, diabetes, smoking, sedentary lifestyle. There are some elements of family history that factor in. But the evidence and the data is that maybe 80% of heart disease can be explained away by these types of risk factors. And then, actually, I said that wrong. Up to 80% of the disproportionate impact of heart disease is because of non-clinical factors, what we call social determinants of health. So it's things like access to healthy foods, access to healthcare, and those types of things. So while the risk factors all funnel down to those handful of things that I've mentioned, a much larger impact is on things that are not just what you eat and your ability to exercise or stop smoking. It's a lot of other factors. Can you get to the doctor? Do you have access to healthy foods? Those types of things.
Wow. Okay. So in that sense, the general population, they have more resources, more access.
Correct.
Maybe more, they're educated when it comes to their bodies and
Correct.
going to the doctors. Okay. Is there anything in place to help minority communities get more access?
So a lot of strategies come to bear. Some of it starts at a public policy and a policy level. So sort of creating infrastructure where communities can have access to healthcare opportunities. So community health clinics are a great resource, trying to avoid food deserts so that people have more access to healthier, fresher foods and not just sort of the gas station mini mart, which is sort of highly
The
processed,
Wawas.
lots of salt, lots of sugar, creating safe walking environment, access to housing, financial and other types of access. So lots of these types of things really that start at a community and then build upward are really what's going to be the difference for many people
Yeah.
to sort of combating heart disease.
Okay. How does access, knowledge, and understanding of healthcare impact heart health minority communities?
Yeah. So as we touched on right now, so I think of access in two ways. There's sort of physical access. Do you have transportation to take you to a doctor's appointment? Is there a doctor in your community, in your state, that can meet your needs? And then financial access. Do you have health insurance? If you have health insurance, do you have a high copay? Does it cover your medications? Do you have access to Medicare or Medicaid? So I think these are the elements of access that really are important for us to focus on and to work on. When it comes to literacy, there is also a problem of medical literacy and health literacy. So people sometimes don't know what the best ways to cook and prepare foods are. They may not know that too much salt and too much processed foods increase your blood pressure, for instance. They may not know that frying foods is bad for your cholesterol. So there are many things that sometimes when you're in the healthcare business, you take for granted. But every day when I see patients, it's an opportunity to say, look, you are doing certain things that you can change today that can impact your health.
Yeah. And again, we're talking about minority communities and
Yes.
populations
Yeah.
and being a melting pot here within South Florida,
Yeah.
they're so big on the fried foods
Yeah.
and the rices, and
Yeah.
it is passed down from generation to generation. So it's up to that person to break that cycle and to be educated. And, I would talk to, I'm a health fanatic. I watch
Right.
everything I eat.
Right.
And I would talk to my mom. She's old school Jamaican and she loves her oxtail and all of that. And I'm like,
Yeah.
Mom, you mean you want to cut back on that? Because,
Good for you.
so again, it starts with education and they eat based on what they were taught growing up from their parents and their grandparents, so it's a really big thing, in the Caribbean and the minority community.
But I think your point, Nikki, is an excellent one. And I think younger, more educated, well-informed generations like yourself, you can teach your parents and grandparents and be an example to them. And certainly for the generation behind us, sort of lead the way by example. But I think that's an excellent point and an opportunity. Each one of us can do our parts within our own microcosms and wider communities.
Yeah, those plantains are good, but put them in an air fryer.
Yeah.
Don't fry them in the oil.
Exactly.
Okay.
Exactly.
What role do lifestyle factors, again, like diet, exercise, and stress, play in cardiovascular health, especially among minority groups?
So they are of paramount importance. So healthy diet, limiting your intake of sodium, sugary beverages, increasing your intake of fresh fruits and vegetables, extremely important. If you smoke, stop smoking. Stress management, very important. They're all manners of stress, but stress often leads to poor dietary choices. Sometimes stress leads folks to not exercise or to pick up a cigarette or to pick up alcohol. And very often stress creates this internal cycle that sends cortisol and adrenaline surge and these sort of stress hormones that when you are chronically exposed to them, increase your risk for high blood pressure and diabetes. So stress writ large is very important and really important for folks to think about ways to diminish their stress.
Yeah, and I know stress, it's intangible and it's also tangible.
Yes.
And do you think because a lot of these minority groups, they're working longer hours or, in order to have the resources to put a roof over their table, to eat properly. So are there maybe any kind of economical factors as well that may contribute to them not going to the gym or not being able to live a healthier lifestyle?
Absolutely. So I think a lot of it comes down to economics or time or all of the above. So if you're working 2 jobs, getting home late, or you don't have the excess disposable income for a gym membership, these are disadvantages that you are placed at. There's a concept of sort of stress that you can control and then sort of stress that is out of your control. So many times when people are in situations of stress where they don't have the flexibility, for instance, if their child gets sick, that they can't take off of work. That sort of stress is different than perhaps you having to meet a deadline, which is sort of stress that revs you up and gets you to a certain goal. So the stress that is out of your control has been shown to be more harmful to your health, and it is more prevalent in minority and under-resourced communities.
Yeah. Are there any genetic predispositions or hereditary factors that make certain minority groups more susceptible to heart disease?
There are not a lot of well-defined genetic predispositions. Certainly, there's hereditary factors. So if your parents had heart disease early in life, for instance, your dad or your mom with heart attack or stroke in their 40s, for women maybe in their 50s, those can suggest some sort of genetic predisposition or family history. So we like to say you can't change your family history, part of your risk equation, but you can change everything else. But the shorter answer is not so much, except if your parents had heart disease very young in life, then that might suggest you are at higher risk. And what do you do with that information? You do all the other things that you can do to reduce your risk.
Yeah. Like in my family, again, it's Caribbean, so
Yeah.
there's high cholesterol, there's diabetes, there's high blood
Yes.
pressure, and
Yeah.
I was taught that it's hereditary, so it can pass down and pass down. So I said to myself, what can I do? I'm like, I'm not trying to. I don't want to be
Yes.
on pills. I don't want to
Yeah.
like have to inject myself. So what can I
Yeah.
do now to break that cycle?
Yeah.
And it's about education. So I'm so happy to say that. When I get my physicals,
Good.
I'm pretty healthy.
Good.
I'm not on any pills because in my 20s I wanted to break that cycle. I saw what my mom
Right.
had to go through, my dad had to go through, my grandparents, and I'm like, it may be hereditary, but it can be reduced, or it could be controlled.
Yeah.
So again, it's education, and it's knowing that we don't have to necessarily, if I'm wrong, let me know, you're the doctor,
No.
but it's breaking, you just cut back. It's a lifestyle, how you eat, how you're active in your lives. And I can say I'm a testament to that because, knock on wood, I am not on
Good.
any pills or
Good,
anything right
good,
now.
good.
My levels are balanced.
Excellent.
Right.
Well, I think you touched on a few important points, Nikki. One of them is knowing your numbers. So what I like to tell patients and people in general is many of the things that contribute to heart disease, you can't know that you have them unless you measure them. So it's not an endless list, but knowing your blood pressure. Most people can access a blood pressure cuff, or sometimes just going to the local pharmacy or supermarket, you can measure your blood pressure. You do need to know your cholesterol numbers and your blood sugars, and those will require a blood test. Many of those screenings can be done very cheaply and easily. They don't require a physician, sometimes a nurse or a nurse practitioner. So finding areas where you can get your testing done so that you know what you're up against and what your risk factors are. And many community organizations can help you with these sort of screenings and checking those numbers.
You got to get those screenings, and you got to learn your body,
Yeah.
what the body likes, what it don't like. Okay.
Yeah.
So how can catheter-based procedures like angioplasty specifically benefit minority patients who may face advanced cardiovascular issues?
Yeah. So as you say, those are for advanced issues. And our goal with these types of presentations and information is that you don't get to that stage, so that you've worked on your risk factors. But for people who do need intervention, so an angioplasty is where a balloon is threaded up to the heart arteries. The blockage, so the heart is a muscle, it gets a blood supply. If you get a narrowing in the artery, it can cause symptoms. If that artery gets narrowed, or that cholesterol in the artery ruptures and causes a sudden heart attack, putting a stent after you've ballooned the artery open, putting a stent, which is a metal coil to keep the artery open, can be life-saving. It can abort that heart attack and reduce the risk for others. So these are technologies that are available. You have to have access to healthcare, hopefully access to an emergency department if you do have sudden onset of symptoms. So again, you can see where that issue of access can come into play. But for those who need it and who get to the right settings, those are as available and as effective in minority communities.
Have you seen there's been like an increase in the angioplasty with patients?
We've actually seen a little bit of a decrease because of better control of risk factors like lowering cholesterol, better medications for it, and more awareness. So coronary disease or heart disease is oftentimes a chronic condition that, if well managed and caught early, we don't need to get to a stage where you need an angioplasty or a stent.
And that's the whole point. Let's not get to that stage.
Exactly.
Yeah. So, what preventative measures can minority communities take to reduce their risk of heart disease?
Yeah, so I think of that in sort of two parts. So the community level stuff is working on infrastructure, working on making sure that there's access to healthcare institutions, community health partners, very often working with organizations like the American Heart Association. Are there blood pressure screenings that can be done in your neighborhood? Are there food deserts? Are there food pantries that can be supported? Those types of community level things. And then at the individual level, there's a a uh, a campaign that the American Heart Association has called Life's Essential Eights. That it's Essential Eight that helps us focus on the risk factors. And we've touched on most of these during this talk, but it talks about eating healthily, talks about staying active, it talks about getting healthy sleep, which we haven't touched on, managing your weight, managing your blood pressure, managing your cholesterol, quitting smoking if you smoke, and managing stress. And these are all elements of a heart healthy lifestyle. So we don't want the focus on heart health to be on just disease, but we want to
Yeah.
promote health and well-being.
It's a lifestyle and it's discipline.
Yeah.
It's our vessel. We have to take care
Yeah.
of our vessel.
Yeah.
Literally. So, how important is early detection and screening for heart disease in at-risk minority populations, and what barriers exist?
So early detection is really the key. So we want to be a step ahead of that heart attack, that stroke, that heart failure. And early detection really gets back to knowing your numbers, your blood pressure, your cholesterol, your blood sugar. Um, if you have already developed risk factors and maybe have some heart disease brewing, then with your practitioner, your nurse practitioner, your doctor, you might be a candidate for additional testing. There are some types of scans called calcium scores that can tell you if there's already some hardening in the heart arteries, very often an EKG or an echocardiogram. But I think the main takeaway point is early detection really means early detection of risk factors, blood pressure, cholesterol, blood sugar.
Oh, got you. So when they go get their physical, or then they'll show on the charts. Yeah.
Yeah, and if you're
Yeah.
found to be at increased risk, then your provider, your physician, your nurse practitioner will then suggest to you, all right, well, we need to do certain things to address your risk. Or if your risk is high enough, you know what, we need to do some additional testing because you may already have some heart disease.
Got it. This is kind of like off track here, but
Uh-huh.
is it true that like for the heart health, you should eat more like red, hearty fruits and vegetables?
That's a great point. I don't know about red being so important, but healthy fruits and vegetables
Okay.
of all varieties and colors is important.
Doesn't matter if it's darker or lighter,
I don't think
like
so.
blackberries versus, I don't know, like an apple.
And, the blackberries certainly are one of these superfoods. So
Okay.
if you had to choose, maybe that more than the apples, but they're
Okay.
all great. And you know what they say, an apple a day. I don't know where that
'Cause a
came from,
doctor.
but it's a healthy food. It's full of fiber, and it's natural sugar as opposed to processed sugar.
Got it. Okay. So what are some of the latest advancements in cardiology that are making a significant impact on the diagnosis and treatment of heart disease?
I think some of the latest advancements that are of great interest to the health professional, but also to the patient, is that many of the treatments for heart disease are now being able to be done less invasively. So we have what we call transcatheter approaches. So maybe 10 or 15 or 20 years ago, if you had a very blocked heart valve called the aortic valve, the only treatment for that would be a surgery where the surgeon opened your chest. Now we can do a lot of those same types of procedures just through a small incision in the groin. So less invasive management of heart disease has opened up the possibility that more patients can access them because patients can tolerate these less invasive procedures more readily. So there are procedures for valve disease, there are procedures for irregular heartbeat, atrial fibrillation, which is a common cause of stroke, can be treated less invasively. And we already talked about the angioplasty procedure for opening narrowed arteries. You don't always need bypass or open heart surgery.
Yeah. Do you see there's a difference in age range or male versus female when it comes to heart disease?
Very often, males will present earlier in their 40s, sometimes 30s. And then women, very often in the peri and postmenopause phase, then start to catch up. So maybe in the 50s and beyond.
This has been a great conversation. Thank you so much. Thanks for sharing this insight with our audience. And be sure to hit that subscribe button on our channel here to keep up with the latest health and wellness information and tips from our experts. Thanks again for watching.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Baptist Health Talk is brought to you by Baptist Health, the warmer side of care.